Good morning, everyone. I am Nikisha Barbie, and I am so grateful to be back here at St. Martin's Church once again for annual enrollment. And listen, every time I step into the house of God, I feel like everybody is family. So I want to say good morning, family, today, okay? Amen. So, yes, for those that do not know me, my name is Nikisha Barbie. I am the daughter, the youngest daughter of Miss LG, here, one of your members here at St. Martin. And I am a community outreach specialist with Sage Health. And I have invited a few of my brokers here to talk to you guys about annual enrollment. So, this is the year that it is starting, and I know it gets confusing, right? It gets confusing, kind of intimidating sometimes for me, I know. So I've invited my broker here, Miss Tanya, raise your hand. Miss Tanya Bell and Miss Gloria Dunn is here as a support. So I really appreciate them for being here. And as an outreach specialist, we do partner with a lot of brokers throughout the year, a lot of our trusted brokers to kind of go over your plans and make sure you stay updated with your prescriptions and all of your healthcare needs. So I'm so excited to have you guys here today. Thank you so much. So I do have my sister in the back. So before you guys come up, I want my sister to kind of talk about what she does at her location, Ms. Marcia Barbie. But Sage Health, for those that do not know, we are a primary care physicians clinic for people that are 55 and over. We accept all Medicare Advantage plans, except United Healthcare and Blue Cross Blue Shield right now. We also accept traditional Medicare and any and all med supplements at this time. First appointment with our doctor is a whole 90 minutes. So what we are is a value-based company, and value-based meaning we want to spend way more time with our patients instead of a regular 15 minutes, and then you're going to send you out for assessment, right? So you're going to be with our doctor for a whole 90 minutes. Then we're going to take you through a whole comprehensive self-examination. So we are a preventative clinic. So we're going to check for Alzheimer's, dementia, diabetes. We're going to take your blood draws. We're going to do blood pressure check. We're going to do the whole nine on you. Okay. We also have an in-house social worker because we know a lot of our patients need help with paperwork. Everybody has family, but family is not always there to support you, right? So we do have a social worker in the house to kind of help you go through all that paperwork and navigate a lot of things out in the community. And he also does house calls, amen. So, right. And we also have a care coordinator. So a lot of people have specialists in the community, and sometimes you need home health. Some people get a little older. You got family members that kind of need an extra person in the house to kind of help you out. So we will help coordinate that home health services. You need to go see a back doctor, a toe doctor, anyone. We will coordinate all of those needs for you. So what we're trying to do here is take all of that anxiety off of you in order for you to just come in and get great health care. Okay? So each of our locations, and we have three locations in Arkansas right now. Little Rock, we're on South University where Target is. We are in that shopping center, maybe three doors down from Tropical Smoothie. North Little Rock, we are right next door to Kroger on JFK. And in Bryant, we are off North Reynolds Road. And one of the biggest things we do that our patients absolutely love is we provide transportation. Free of charge, okay? You do not have to use your Advantage plan or anything or insurance to pay for this. We will pick you up for your appointment because we want you to come to your appointments. We want you to keep your appointments. That's how you're going to maintain your health, okay? So we will pick you up, and we also, some days you have an appointment, then it's raining, it's storming, or snowing outside. You really don't feel like coming out to the clinic. However, you want to keep your appointment. So we have telehealth. All right, just give us a call to the clinic, and we will provide a telehealth appointment for you. So you won't lose that appointment. And also, we have nurse practitioners that will make house calls for you. So we're trying to make it easy for our patients to just come in and get great health care and let us take care of the rest, okay? All right. So anyone that would love more information about Sage Health, I will be here for the entirety of this seminar. And just come up to me, talk to me. I can get you scheduled for a tour at one of our locations and kind of talk to our doctors, our MAs, or our nurses, kind of see if it'll be a good fit for you. All right. Thank you guys so much. And I'm going to bring up next my sister so she can kind of go over some of the things she does at her location. And then we'll have our two brokers, Miss Tanya, to come up and talk about this AEP thing that's going on because Medicare is so important. And you guys, I'm going to tell you how important it is. Before you speak, I had one of my patients, she was in a frantic mode. She called me. She was like, Nikisha, I'm trying to make an appointment, to come to the doctor, and they're saying I'm not eligible anymore. And I'm like, well, what happened? I won't mention her name. What happened? Well, someone switched me over to another plan. I said, well, how did that happen? Well, I did talk to somebody, and I said, well, did you give a yes to anything? Well, I probably said, that's it. You do not give a yes to no one that's calling your phone ever. Okay, we would want you to call us first or utilize one of our local trusted brokers to help you change any type of Medicare plans or any insurance information as needed. But thank God I was able to get back to one of my local brokers and we got them changed and back over to Sage. But I cannot stress this enough. Do not answer those spam calls because they are calling, okay? And I don't care if you don't understand what they're talking about or you kind of understand, but if you give those people a yes, they're going to switch something. And you're not going to know what they're doing. And by the time you look around, you're on another plan. Okay, so it's very important to have a local broker and direct all information to your brokers. All right, well, I'm going to sit down, y'all. All right, Miss Marcia. Thank y'all.
Good morning. Good morning. It is always good to have someone who cares about the community and cares about the people. And I can say that about my sister. She loves what she does, and she is going to put 100% into helping everybody understand everything that's going on. Because I can honestly say this. I've pretty much been in like the medical care world for quite a while, majority of my working life, and it changes constantly. It's constantly changing, but you don't know. We're the last people to ever know about the changes that ever happen. So when you always have a good person on your team, a God-fearing person on your team that cares about the community, that's always a plus. And so we always love when the brokers come out because they actually do it because they care about the community and they want to make sure that you understand what you're getting yourself into. Because I've got some stories too, but we ain't gonna go into it, but I've got some stories where people just didn't know. They just did not understand. And they get pulled into those things. It may be a little, oh, you can get this little card that'll get you some free glasses, or you can get this food. No, no. You got to look at what you got going on for yourself and your health and your wealth and your health issues. That's how you pave the way for your plan. So, but my name is Marcy. I am the oldest daughter of Miss LG back here. Miss LG, stand up, lady, stand up. Yes, ma'am. That's my mama. That's my mama. And I am the clinical liaison for Timber Ridge. And Timber Ridge is a restorative rehab in Benton, Arkansas. Have you heard of Timber Ridge? Everywhere I go, I run into someone that has worked at Timber Ridge. With them. Okay. Okay. So it is a hidden gem in Benton. It really is. I always say like I've had many jobs, but when I got here, and it was a God thing. I didn't even apply. It just came out of nowhere. And I said, this is my home. Like just what I do, it's my home. And so it is a restorative rehab for traumatic brain injury, spinal cord injury, and stroke. So there are a lot of changes that are going to be happening after the first of the year where there is a mandate that will start January the 1st. Before, we were not able to help more people that have had a stroke because usually when you have a stroke, you do end up with a brain injury. It's an anoxic brain injury or a hypoxic brain injury. And the insurance companies were like, well, no, we get to decide what type of brain injury, and it's just traumatic that we're going to pay for. Well, we fought and we fought this past year. And in the state of Arkansas, we got a mandate where the insurance companies does not determine what type of brain injury the insurance company will pay for. It's all brain injuries. And the doctors determine when, where, and how long you go for rehab. So that is an awesome thing for us. It's paving the way. We're going to have more outpatient clinics and outpatient facilities throughout Arkansas in the next few years for rehab for stroke. So I'm excited about that because I can honestly say the age is dropping. I am seeing 30-year-olds. I'm seeing 20-year-old. Stroke doesn't have an age anymore, and I'm just going to be honest with you. It does not. I'm seeing so many young people coming in. And so we have to be able to accommodate all ages everywhere. And so that is basically what we do. Also, we do have a kid program for those people who do have those kids that have brain injuries because kids have that also. I bring in a number of kids that suffer from brain injuries. But yes, my information will be in the back along with a card. If you have any questions about it, feel free to reach out to Miss Elgie. She can point you in my direction or she'll have me back, however you want to do. But yeah, I'm excited to hear about these changes now. I'm going to bring Nikisha back up so she can take over the mic again.
All right, you guys. So I'm gonna bring up Miss Latanya Bell. I met Latanya. When did I meet you? Last year? Was it last year? Was it the year before? At one of our rollout meetings. So listen, I met her at one of our rollout meetings and her personality just sparked. And from there forth, we started working so well together. And we was like, you know something, we family now. You will not ever get rid of me ever again. You know, the way she went into the room and broke things down for our patients and for those that were interested, I was very impressed, and I love the way she does it, and I love the way she cares about her clients. So I am so happy, so thrilled to bring up Mrs. Latanya to help you guys through this AEP year. Come on, Miss Latanya, let's give her a hand.
Thank you. Thank you. So I feel like I'm at home. I feel like I know most of you. I'm not going to hold you with a lot. So I'm an independent agent. I write for 9 different companies. Excuse me. I just want to talk about some of the differences for this year. Okay. Typically, with insurance, with Medicare, in the past years, what has activated the big conversation is what about this food card? So I like to use the term, they manipulated the system. So typically, when you get a food card, you have to be on Medicaid. Okay, what activates or has activated in the past the food card is Medicaid. If you have a dual plan, if you're on Medicare and Medicaid, you automatically get the food card. So that changed with this administration for 26. It doesn't get activated with Medicaid. It gets activated with a chronic illness. There's about 70 different chronic illnesses from autoimmune, diabetes, mental disabilities, total mental disability. Um, if you are debilitating, you have if you're a paraplegic, um, I cannot recall them all. We can go over them all, and they're easy it's things that a lot of people have. There are illnesses a lot. When they say chronic, just like autoimmune, a lot of people may not activate or think that that's a chronic, but they have said they have included that in one of the things. And so those cards, they range from 33, now I'm looking at you, Miss Gloria, from 33 to $225. So it depends on the plan. and it depends on what illness you have, whether or not you'll receive that card. I'm trying to think of the most important or the big communication issues that we have. The other thing that is most important when it comes to the changes for next year is when you look at, I know that here in the city, there may not be a lot of concern or need for transportation. In the rural areas, they are, but a lot of the plans have dropped transportation and put those funds somewhere else. So if you need transportation, you need to make sure that when you're talking about your plan, you make that known. Because whether it's Humana, United Health, WellCare, whatever plan you're looking into, some of those plans that had transportation last year, they don't have transportation this year. They've kind of put the transportation in a lot of the dual plans, and then in the regular plans, they don't have them because I guess they're thinking you don't need them. Okay, so I just want to be clear to say whatever needs you have, the biggest thing about the Medicare scene in my eyes is what are you going to do for that year? A lot of people look and say they want to do 50 things. No, what are you going to do that year? So for 2026, what's important for 2026? That's what you focus on. And then once you get that in your eyes, then that's what you focus on, and then you worry about 2027 and 2027. Okay? And I want to say really, really quickly, one thing that a lot of the benefits have gone down. So if you have anything left on your benefits for this year, get to calling. Talk to if you need dental work, if you need eyeglasses, whatever it is that you may need. Now is the time. You still have over a month. You need to go ahead and get in and get those benefits that you've left on the table because you may not have as good of a benefit for next year. So don't wait. I have people that are anticipating the plans for next year. Don't wait. Go ahead now. Call, get those appointments in so that you can utilize both. Okay? You can utilize what you have left for this year and you can utilize what you have coming for next year. Can I answer any questions? Because everybody's circumstance and situation may be different. And I've learned with doing this that when you give too much information, you only confuse. So I want to answer if anyone has anything specific, depending on what it is. I may have to go talk to you, separately, but if there are questions that maybe I can answer that you've had throughout the year that you didn't get an answer for. Come on now. Okay. Yes. Yes. Okay. Yes, ma'am. Yes, ma'am. Medicaid. So you'll contact DHS. So the answer short is you would contact DHS and qualify. Make sure that you give them whatever they need for your qualifying information. You should, even if, I want to say this, because some people don't know or understand that even if you don't qualify for Medicaid, you need to ask or try and qualify for LIS, which is low income subsidy. That helps you with medicine only, with your drugs. But I do know people who qualify for LIS, but they don't qualify for Medicaid because they're two different entities. Now, if you qualify for Medicaid, you will qualify for LIS, but it doesn't go the opposite. You can qualify for LIS and not qualify for Medicaid. Did I confuse anybody? Okay. I did? I confused you? I'm sorry. Oh, okay. I was like, I'm sorry. Okay, so is there another question? Yes, ma'am.
When does the benefits run out for this year?
December 31st. Okay. And so let me say this too, because I have I don't understand so I have some clients that are receiving letters from, let's say let's say Humana, you're with Humana, but those clients are receiving letters from United Healthcare and Aetna and WellCare. I don't know what's going on. I don't know what they're trying to do. What I would say to you is, just like Miss Barbie said, be careful, be cautious when you're on the phone with these different people that you don't know. Because just like she said, I've had people to come back to me, they were put on a plan, and then they received a letter with cards from a different plan. And we're not sure what happened. It's confusing to me because they say that they didn't even give them their Medicare information. So I don't know how they're getting it if they didn't give it to them. But you have to be cautious. You have to be careful because you're the ones that they're targeting. I just have a problem with that completely, but you're the ones that they're targeting. They feel for some reason that you're an easy prey, and they're looking for you to take advantage of. So you really have to be careful when you're talking to people that you don't know. All I can say is well, I want to say this to the group, when you get your cards for next year, I know that a lot of the cards, whatever plan you're on now, that plan, if it's United Health, WellCare, whoever, when you get those, if you're already with them, most of you have probably received your cards for next year. The understanding is that you're already enrolled for next year. You're not already enrolled. They're just sending you the cards if that's where you want to go. So I've had people to say, well, I'm already enrolled. I can't move. You do have a choice. Well, so they are being proactive. Let's say it like that. Okay, they're being proactive. And they're saying, well, you have our service. We're going to go ahead and send you the cards for next year, because they don't know what you're going to do. And they're taking care of their members first before they, deal with someone else. But you still have a choice, however you want to go. Okay. That's what I want to make clear, is that you do have a choice. And I would say to you, leave those cards. I always tell people, put them in your top drawer, because you don't want to get confused, because they look a lot like the cards you're using now. So you don't want to get confused with the new card and the old card. Just, you can tell, you can fill the envelope and tell that there's a card in there. Just, I say, don't even open it. Just leave it in your drawer until like the 1st of December. And then you can go ahead and activate those cards. Now, if you're not going to get confused and it's not going to, do anything for you, then you can open them, read them and everything. But I have some clients that they get those cards out and then they don't remember where they put them or whatever. So I just say, leave them. You still have time with the regular cards. Just leave them and don't confuse yourself. Okay, well, somebody else gonna ask me a question? No? Yes, ma'am.
Wouldn't it be best, whether you're on Medicare or Medicaid, hopefully everyone has an agent that when they get these different cards in the mail, if you have questions, contact your agent.
I didn't mean to cut you off.
Yeah, because like you say, it is confusing. And they are out there trying to get you signed up, and they could care less what they're putting you on. And if you say yes to them, then it's a whole nother ball game. So what I do, when my phone rings, I look at it. If I don't recognize the number, I don't answer it. I have a answer machine. I still have my landline, because most of the older family members, that's the only number that they have. So when someone calls, I look at it, don't recognize the number, I keep on going. And if whatever they want they can leave a message, and if it's something I need to return, then I will. Otherwise, because my phone rings practically 24/7.
with spam calls. And I
Yes.
and I agree. So for those of you that have an agent, I would definitely say you need to converse with your agent and let them help you with it. I do want to also say, I know for people like me, this time of the year is crazy because everybody is calling, and it's not that for me, I will speak for me. It's not that I don't want you to call, but most of the time you'll have to leave me a message and I'll call you back because I am out. This is the time when we can work the hardest and see the best return, and the biggest reflex, right? So we're out working most of the time. And I know the last couple nights it's been 10 o'clock and after since, when I get home, trying to rejuvenate for the next day. But call. I always tell people, even if I can't answer your call, call. It's important that you call because I will call you back. I will definitely call you back. If something happens and I can't call you back, call me again. Make sure that you get what you're supposed to get from me because that's what I'm here to do is be an agent that you can depend on. So I need you to call me again. There's a lot going on this time of the year. There's so many people that need help that it's almost impossible to reach everybody, but that's what we want to do. And I tell people I personally think it's better to have an agent because you can hold them accountable. You can call them and say, hey, you said, instead of calling a company, and they're there to do what they do also. But I even have people that come to my house if I if I don't answer the phone, they will knock on my door and say, hey, I've been trying to call you, okay, now you definitely have my attention because I'm right in front of you. But definitely I am solely saying, yeah, I think an agent is better. You can hold them better accountable in situations like that. Did I answer everything? Yes, ma'am, please. Yes, ma'am.
That will be coming to the different advantage plans for next year.
I do. Not well enough that I can name them all off right in front of
Well,
you.
which
Now we do have she may be able to, now I do have, actually Humana is my biggest writer, insurance company this year. I'm normally really good with United Health and Aetna because they offered the transportation better in my area, but Humana this year popped up and they have about 3 plans that I was just like, whoa, and they really did I don't know that it would be a plan that you would be necessarily interested in, but I'm gonna, I don't know what her name is, but Brenda, okay, but I'm gonna let Brenda did you want to say? Okay, I'm gonna allow Brenda to talk more about, I think are you exclusively with Humana? Okay, so she is exclusively with Humana, and I'm gonna let her kind of tell her spiel on some things Humana related. And like I said, if you have questions for me, by all means, but then yeah, you can come on up, Brenda. I'll let you have, yeah, or did you? Well, yeah. So I'll give it back to Miss Barbie and then she will introduce. Oh, I'm sorry. I'm so sorry.
Ask your question.
No, please. I don't want to. I didn't want to stop.
No, I just had a comment and I think Alma did a good job saying, what my thoughts were.
Okay.
And that is, this is a courting time when other companies are trying to sign people up. And, if you don't need anything different from what you have, then you can ignore those courts.
Absolutely.
Because people are, like you said, they're calling And they're sending information, and it's all very confusing when you get all those different cards and information. So I don't need anything, so I'm ignoring those cards and those calls. Now, last year I needed a drug company.
Okay.
And so I did switch. So just to piggyback on Alma, it's
Absolutely.
just so confusing.
Absolutely.
And if you don't need anything, you can certainly ignore it.
Yes.
Yes.
So I want to say something really quickly to that, and then I'm going to shush. So what I personally tell people is, and I'm not saying that you're saying this, but what I tell people is the insurance policy, the plans, they change for the most part yearly, right? I tell people when that information comes in the mail, look at it, because a lot of people don't look at it and they think that they have what they need. What I say is think about what you are doing for next year and see if that plan gives you what you're trying to take care of for next year. Because a lot of people will bypass that and miss out on things that they could get that could help them throughout the year. I don't know that older people do this, but I shop for car insurance every year because it's always going up. And I find sometimes that I get benefits from someone else this year that I couldn't have gotten last year. Not that I necessarily needed it, but I want it because I'm paying for it, so I want it. So I say to you to shop. Just make sure, don't assume, make sure that you're getting what you need. And if you are, yes, please leave everybody else alone so that something like Miss Barbie was saying doesn't happen. But I feel like the biggest problem is not being informed, because you can't jump around like you could in the past. So if you don't have what you need, you may find yourself missing it, if that makes sense. Okay, because I don't want to make it seem like I'm jumping on anyone, because I promise you I wouldn't, and I'm not. But education is the key. Make sure that you know what you have year to year, because the plans change. And the insurance companies cannot look at every single person and pick what's right for every single person. That's your job, to make sure that they provide for you what you need. So that's why we want to help you do that. If it doesn't give you what you need, then you need to move. And if it does, you need to stay, because why would you leave them if it gives you what you need?
I just wanted to piggyback on that, to let everyone know that, every year you might get what you call an annual notice of change in the mail. Some people don't even see this or don't even look at it. I got a sister that didn't even look at it. So that's one way that you can look and see if your insurance plan meets your need, and to get with an agent that you can see right in front of you, talk to her and make sure that nothing, has changed that you need, or that you got all your needs.
That's
But-
right.
Hold on, question.
No.
This time of year, most people in our age are dealing with budgets. And I think the vast majority, what I want to see was, has the increase in coverage on all of the insurance companies gone up? And I think that's what we mostly look at. So if this company is increased 3% and it has what I need, and the other one has 10% increase, I'm going with this one based on my monetary concern. So as the insurance companies go, like car insurance too, which one has increased the most? Is it Humana, Health Advantage, or do you know that?
So from my experience, the plans are competitive, okay? Oh, I'm sorry. I'm sorry. I guess I was giving her a chance to say too. So for the most part, the plans are competitive. You won't find a plan that's going to say, 1,000 and then one that says 20,000. That would be crazy, right? Because they know that you're not going to go for the 20,000 plan. So they're competitive. They may be $1,000 difference, but then you got to dig into the plan because where this plan may be 8,000 and this plan is 9,000, I'm talking about the MOOP, the maximum out of pocket. But then it may give you $1,000 more in dental. Or it may get, so you got to look at the whole picture before you say they're competitive. They're not crazy. They know that you're looking at all of the information, right? So that's why I'm saying if you see one part, you got to say to yourself, well, I'm gonna have cataract removed. So I need to find out
A lot
about,
of people just, I fell in love with Humana. I don't care what happened. I'm gonna stick with Humana.
okay,
And they may have increased some. And the one that's competitive may fall within a bracket that will fit their budget.
mhm,
And they probably need to look at that. And a lot of times they don't. And that's what you're saying about knowledge. They need to look at it and see if you can give me what I need on this plan and you're a little bit cheaper than the one I have, then I'm gonna go with the one that's cheaper for my budget, you know? And so people are not looking so much at that. They fall in love with a company. They fall in love with a car insurance. I got State Farm and they'll stick with it. And they can just go up, 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 and they won't even pay any attention to it.
I agree.
That's what I was saying. The increase that's coming, it won't be an astronomical
Right.
amount, but it'll be an amount to where they could, 0.5% over a time period is a lot of money.
Yes, it
And
is.
so if they move it up 2 pennies, 3 pennies, you say, oh, that's nothing. Well, in the long run, it'll kill your budget. So
You're not gonna be an agent soon, are you? Look.
I was.
Oh, that's why, because I was like, you making some sense, like what we would say. Okay, but you're absolutely right.
Yeah.
You're absolutely right. Again, education. If you can't, I have some clients that are in the city, I say the city, they're smart enough, they're able to go online and put all this stuff together. And when they call me, they say, this is what I want. Oh, wait a minute. Let me do my job first. Hold on, let me ask you some questions. And most of the time, I have a few that are right. But I still want to talk to you and say, did you consider this? Did you consider that? And then if you did, oh okay, But I feel like I would be doing you an injustice for me not to ask those questions, is basically what I'm saying. So just educate, just make sure that you're getting what you're looking for. And if you are, don't move. And when they call, hang up. You can be nice or whatever, but hang up. And like Miss Barbie said, be careful when you say yes. Those calls, I get them all the time. As soon as they pick, they'll, your phone will ring and you'll pick up and they'll go, hanging up. Because I know it's somebody I don't want to talk to. I don't know who you are. I don't want to talk to a machine. But yeah, so I'm going to let.
Well,
Brenda-
before you sit down, I'm back here at the back.
Okay.
Okay, I've got a question because you said something about Aetna,
Yes.
prescription drug. When I first got in like 2 years ago, it was almost, right at $10 a month. Then this past year or now is about $24 a month. Then I got a notice saying it's going to go up to about $74 a month. So,
Know what they doing. I said, like I said, last year or this year was, everybody that I had was on Aetna, but the reason why I put them on there was the transportation. They gave 100 miles. I think it was 100 miles.
need transportation. I need
You need
cheap.
the drugs.
Yeah, and I need a
Yes.
cheap price.
So I people off of that plan. I
Okay.
found some other plans, Humana One, that just makes more sense. It pays
Right.
about the same when it comes to the meds for the identical price. So again, when you see something like that, you paid attention to your ANOC, your
Yeah.
annual notice of.
Yeah.
When you see that, you need to say, hey, I need some information because why is it almost tripling?
Right.
What's the problem? Yeah, you need to talk to somebody because it's important that you don't owe them anything. You don't owe Aetna anything. You're looking for a service, they're to provide a service. So you need to give them, or they need to give you what you're looking for, or you need to shop. If you don't find anything else, then you stay,
Right.
but you need to shop for yourself.
You have a question?
And I also want to just point this out when it comes to those insurances on the rehab side. That's why I say you gotta know what your, where you are standing with your health. Because I've noticed you have those plans that are perfect for a majority of you who are independent. You're just basically going to your PCPs. You may have, just a few, things that you may need to go a few times more during the year. But on the rehab side, like say, if something happens to you, whether it's a stroke, whether it's a fall, Aetna is not a good one. I'm just gonna be honest. I'm actually going through that right now with my aunt who had a fall. Aetna was horrible on the rehab side. And I'm just gonna be honest, because I don't stand with the insurance companies. I'm on the rehab side. So, but it was horrible on the rehab side. It was. They were like quick to say, no, she's gonna get this many days. And okay, she fractured a spine and a knee. 10 days and you're telling me she's done? No. So, and it was a fight just to get 7 more days out of them. And then it was no after that. So she's home now. So if you know that in your health that you need more, or if hey, I could possibly hurt myself and I may need rehab or even home health, they give her 1 day a week of home health. So always keep that in consideration. Ask those questions, like seriously ask those questions. How many days would I get for rehab? How many days of home health would you send out? Will you pay for home care? Because they do not pay for home care. These things I did not know about it. So those are the things. I mean, but if you have a company, Sage is a wonderful company because they pretty much will provide those things for you. That's what I love about Sage. But ask those questions.
Absolutely, absolutely. Good. Any more questions before Miss Tanya have a seat? All right, and she will be here for those that would like a one-on-one with her. And Tanya will set up a place for you to speak with any new opportunities. Now, my next agent, Miss Brenda Kelser, she and I have been working for about 3 years now. She's another one that when we met, we just clicked and we have not let each other go since then. And she's amazing and she actually cares for her clients as well. And I found it a privilege to work with Brenda and I love working with her in the community. I'm so grateful she's here. She is a Humana rep. And she knows everything she's actually a superhero in Humana. So any questions you have about Humana, she is my go-to lady. So Brenda, I'm gonna let you have the floor. Thank you so much for being here.
Thank you. Good morning. How are you guys? I'm so happy to be here and be able to share this information with you because it's the time of the year, like Miss Tonya was saying, it's the time of the year that you're going to receive 10,000 calls per day and a lot of mail. So just be careful with all those calls and all the mail that you receive. Sometimes they send mail saying they are from Humana. And if you notice, next to the Humana logo is another company logo, right? They've been doing this all the time. I don't know how it's legal, but they are doing it like that. And also all these calls. I had several members. I had a member with Aetna that she was trying to switch to another carrier and she provided her information over the phone and they got all the information of her bank accounts, 3 bank accounts. So yes, so that's why we always said do not provide personal information over the phone, okay? What we do, well, I'm with Humana, meaning that I work for the company, right? So I answer any questions about Humana, the plans, HMOs, PPOs, and like Miss Tonya was saying, it's gonna be very hard to provide information because she did a great job explaining about the season in Medicare, right? What we do as agents, we have to sit with you and go through your needs analysis, right? Just like she said, we have to go through all the information, questions about if you have chronic conditions, if you're a veteran, if you're taking prescriptions, or if you're getting your prescriptions through the VA, because Humana also offers honor plans. Honor plans are for veterans, right? Because we understand our veterans are taking their prescriptions from the VA or TRICARE for life. So it works a little bit different from the other plans. But we also have chronic plans. The chronic plans, you're gonna see the copays for specialists a little bit more lower because we understand that you go to the specialist more often, right? Now, something very big next year with Humana is we are having, well, we have the tier 6 for prescriptions for the chronic plans. All the prescriptions that are for heart and diabetes are tier 6 in that type of plans, okay, which is a great benefit. But something big is with the chronic plan next year, you have transportation, even if you don't have Medicaid. So for that people that needs transportation to get into the doctor's office, the chronic plan is gonna offer transportation, okay? Another benefit that we're gonna get, the chronic plan is gonna continue with the food card. I don't know if Miss Tonya mentioned some Medicare changes for next year, how you qualify for your food card. If you guys receive a food card with your carrier and you don't complete a health risk assessment before the beginning of the year, then your food card, it doesn't matter what carrier, is only gonna be for over the counter. Okay? Let's say, for example, that you have Aetna and you receive $190 every month. Well, if you don't complete the health risk assessment before January 1st, when you go to Walmart to spend your benefit in maybe some fruit or vegetables, they're going to tell you, you know what, this card is not good. It's only for over the counter. So that's why it's so important that you check all the changes and the benefits for next year. Plans that they didn't include transportation, they're actually having transportation. And like she said, there's minimal changes. I feel like with Humana, they are going to be very positive. But just like she said, you need to sit down with an agent, or if you have an agent, to make sure to call, because just like she said, is a time of the year that we're extremely busy and we're trying to get all these calls and we're trying to help all our members. But, we get home 10:30 p.m., 11 p.m. So it's important that if you didn't receive that call from your agent, just make sure to say, hey, you know what, I'm just checking what's going to change for next year. We're also doing seminars. So if you know your agent is doing a seminar, it's important to be able to go and see what's the difference from this year to next year. But I feel like the food card is one of the big changes. Now, Humana for next year is having a new plan. It's a PPO, meaning you can go in and out of network. And that plan, it's a dual plan. So it works with Medicare and Medicaid. And for the food card, it's gonna be $225 a month. And Humana does something very awesome, that is, it rolls over. So for some reason you cannot make it to the store. We understand that some months it's kind of hard. Maybe it's rainy, maybe it's the snow, the first months of the year it's always the snow, and it's when it's a lot of ice outside, it's kind of risky to go out. I mean, you don't want to fall or something. So you're like, I don't want to go to the store like this, right? Well, you know that the money is going to be there for next month in case you cannot make it on time, right? You can use it for, if you have pets at home, you can use it for their food, toys, you can use it for personal care, shampoo, soap, all that stuff. So it's a little bit more flexible, right? Uh, Another big change with the honor plans, we got a Part B give back. It was $100. For next year, it's $135. So it went $35 more. So if you have an honor plan, make sure you review, because we have also 3 different honor plans. So, but it's very, very important that every time somebody asks me, what's the best plan that Humana offers? I will say, I don't have an answer for that, because that's based on your needs. right? We have to ask all these questions. When an agent sits with you, they need to check your primary care. If you have a specialist, where do you go for your dental care? We have something that is called Plus Provider that actually gives you more money for your glasses. So to check all that, if you want silver sneakers, okay, what locations we have around your house that are actually close so you can go and do maybe, a class or work out, transportation. Do you need transportation? Maybe you don't even care about transportation, right? Like I have some people that they are like, you know what? I really want the chronic plan. Okay, it's $40 a month. It rolls over. It sounds great. Specialists are very low, $15 a month, which is, $50 visit, I'm sorry, which is pretty good. But maybe you're worried about something coming up. Maybe you're going to have 3, 4 surgeries next year. And if you want to save money, then HMO, I don't know, Miss Tonya will tell me about other plans, but I don't know if there's another plan with the maximum out of pocket as low as our HMO. It's only 3,600. So for people without Medicaid, that's huge because if you have a surgery, you pay your copay. And then you have to go to the specialist, you pay your copay. During the year, if you reach the maximum out of pocket, that means for the rest of the year, even if you have 3, 6 more surgeries, then you're not gonna have to pay any copays because you reached the max, which is super low with the HMO. But if you have Medicaid, well, we have our dual plans, right? So that's why I always encourage you to ask, just like Miss Tonya said, ask those questions, right? And review what's different next year than this year. Maybe I'm having a surgery. Maybe I know that, I have a new specialist. I need to check the specialist in network because I don't know if Miss Tonya mentioned it, but if you have Aetna is not in network next year with UMS. So if you have a specialist in UMS and you have Aetna, they are not going to take it. Or for example, with United is out of network with Baptist Hospital next year. So that's why it's so important because it can change, for next year. Maybe you're going to your specialist thinking, well, my plan covers this doctor. And then at the beginning of the year, surprise, it's not covered anymore, right? So just make sure that your agent checks your prescriptions, your doctors, your specialists, your glasses, and we're here to help. Sometimes, just like Miss Sonia said, sometimes we are, trying to help all our members. We're in seminars, we're, trying to help new members just to make sure give them a call. If you have their phone number, well, if they're your agent, you should, have more contact with them, of course. But every year to review the plans, what's new. Silver sneakers is one of the benefits that moves. And the plans are not going to change a lot just because we all have a budget, right? And that budget it comes at the beginning of the year. They start building the plans based on that is what benefits we have. But all carriers have the same budget. We all have the same budget. It's just changing based on what that company thinks, okay, maybe I'm gonna put this money in the hospital so my members pay less copays, right? Maybe I'm gonna put it in the glasses. Maybe I'm gonna put it dental. And maybe I talk about a plan with a lot of dental benefits, and maybe you're like, I don't even need dental, right? So that's why it's so important. So if you have any questions about Medicare, we also go through Medicare A, B, C, and D. We also go through the benefits of supplements and Medicare Advantage because a lot of people get confused between Medicare Advantage and supplements. So we have to make sure that you understand the difference between supplements and Medicare Advantage. It's two different things and they were completely different. And also, before I forget, for next year, transportation benefits with Humana went up in benefits. It's up to 115 miles, which is a lot, right? You can go 150 miles. And for people with renal, if you have any kidney disease or cancer, it's unlimited trips. So you can go to your doctor as many times as you need. Okay, that's one of the big changes too for next year. The food card to 25. If you have QMB plus Medicaid, and your agent can check that, we can check your Medicaid level and see if you qualify for that plan. Is 225 food card every month with a PPO plan. We have also our HMO dual plan, and we have that space basically in your Medicaid level. Okay, the HMO is gonna stay 3,700 maximum out of pocket, which again is, I feel like is very low. And just make sure to ask your questions about, for example, skilled nursing facility, all that type of stuff. Because I also had another member that he was going in and out of skilled nursing facility, and the person in charge of the skilled nursing facility said, you know what? You need to go back to original Medicare, because for them it was easier to do the process, right? And he dropped his Medicare Advantage. Then he went back to the hospital. And I said, do you have the money to pay 20% of that hospital bill? And he said, no, I don't. But she said that I need to drop my Medicare Advantage. I said, well, from that hospital stay, you're going to have to pay 20% just because a person didn't want to do extra work, right? So just make sure that you ask all these questions like, what's covered, what's not covered, just in case, because 1 year we can be very healthy and we can feel great. My husband is very healthy, and 2 years ago he had 2 surgeries 1 month after other. I couldn't even believe it because he's always very active, very healthy. You never know. These things happen. So I know that sometimes some benefits sound amazing, like, oh, they're gonna give me 6,000 or $4,000 dental. Are you really gonna use 6,000, $4,000 dental? Oh, if you are gonna use it, okay, that sounds great. But think of the other benefits, the hospital, right? I'm not gonna say the name of the carrier, but there's one carrier right now that I was checking on their copays, 455 copay per day for hospitals. When I saw that, I got scared. I was like, people is not reading this. They're just going through, the benefits that look, the best. And maybe a benefit card that is gonna give you money every month sounds amazing, but if you don't have Medicaid and you have to pay those copays for hospital, 455 a day in the hospital, for me that's a lot. And if your maximum out of pocket is $7,000, well then you're gonna be paying copays until you reach $7,000. That's a lot of money. So that's why it's important to go through all the benefits of the plan. Okay. Do you guys have any questions about Humana? Is anybody here with Humana plans that have any questions or that uh, wants to know more about Humana? You have a question? No?
Seem like Humana is a pretty good company.
PDP plan? We don't have a drop. Thank you so much for that question. For next year, we're gonna have something that is called mirror plans. Okay, mirror plans is just you have a plan and they are gonna have the same, exactly same benefits, same plan, is just with a different number. Okay, because the way that we check on the plans is by number. Because we have a lot of HMOs, PPOs, dual, we have different, right? We have a lot. And if I went to your house before, you know that I have a bag full of books, and sometimes they're like, you have all that stuff, because we have so many different options, right? So sometimes it kind of sounds like we are getting rid of one of our plans, but that's not the case. Sometimes they just change names. Now sometimes depending on the zip code, the area, that can change the benefits or the plans available in that area. Okay, so if you live, for example, in Cabot area or White County, sometimes the plans change on what they cover or what plans are available in that specific area, right? But if you start receiving that mail saying, oh, you qualify for better benefits, no, that's not it, okay? That's just people trying to get you switched to something else. Now, if Humana sends you a letter saying, hey, there's a plan exit, right? And it only has a Humana logo, not another logo next to it, then just make sure that you sit down with your agent and you go through the benefits and see if that plan's still available in that area for next year. But to be honest, I feel like Humana stayed pretty close to what we have. I feel like it was positive. Not supposed to say positive, but it was very positive, the changes for next year. I'm actually very excited about the transportation benefits, the increase of the food card, and our hospital copays are lower than other carriers, which I really like. And another benefit that I really enjoy from Humana is for ambulance. I had a member that his mom needed a helicopter and she ended up paying $100,000 for the helicopter. Yes. So it was very, very sad situation. Now with Humana plans, you have the coverage for both air and ground, okay, which is amazing because you never know when you're gonna need one. Uh, a lot of that stuff that we don't read, right? Sometimes we go directly dental, glasses, and the food card, right? Yeah, sometimes we're like, okay, tell me how much is for the food card. Tell me how much. Well, and if you have full Medicaid, of course, you're gonna be like, I only care about the food card because Medicaid is gonna pay my copays, right? But the government is also making a lot of changes. So we need to make sure that we know a little bit of everything just in case, right? Just like Miss Tonya saying, to get educated about how this works, right? PPOs and HMOs. A lot of people, they don't know the difference about a HMO and a PPO. A HMO, you have to stay in network, right? You cannot go out of network. With a PPO, you can go in and out of network. And also, our HMOs and PPOs have a travel benefit. So if you go and visit your family, if you have a sister or a brother, maybe let's say Texas, if something comes up, you're gonna be covered there too. So you're not worried about, going out of Arkansas and maybe needing a doctor, right? We have urgent care and we have all the screenings available too. We have something very cool. If you have Humana, you're not using it, go 365. It's a benefit that every time that you do screening or if you do a healthy activity, it gives you points for gift cards. And you can spend it in Walmart, Kroger. So it's kind of like an extra benefit. You know what I mean? You can use it for Home Depot. You can use it for Starbucks. I have members that they use it for Amazon. So make sure that you're using it, right? Because maybe you have it, you don't even know. There's some plans with Humana that also offer a Sam's Club discount. So maybe you're paying your Sam's membership and you have Humana and you didn't knew and you're paying the full membership, right? So just make sure that you ask all these questions again. I feel like Miss Tonya did a great job explaining about just Medicare, but if you have questions one-on-one, we're doing appointments right now and we go through all the changes and we compare your 2025 versus 2026 plans, okay? Any questions? No? Well, thank you so much. Thank you.
All right, let's give her another hand. We thank her so much. That's Brenda with Humana. I didn't think my sister was back in here, but I'll go ahead and continue. I think it's wonderful that she has those vendors to come out and help us kind of understand not only just one particular insurance, but the way things work. I say take advantage while we have them here. Even if they're not your vendors, but they can just actually also help you to kind of understand, is this a move that I want to make to, someone else for those who are thinking about moving? Are there any questions that anyone has about any insurance? And I'm pretty sure they can probably answer, but is there any questions that anybody have? None?
I have a question. Every once in a while, I get a phone call from, I don't know if it's an agent or whatever, but talking about Medicare and saying have you gotten your plastic card? You get that phone call.
You want to answer that? Plastic card? I'm pretty sure the physical card is what they're saying.
Yeah.
Yeah,
Yeah,
the
but
problem
it
was,
sounds like a scam too.
yeah, it sounds like, yeah, because they're trying to get your Medicare number. So they ask you if you have your card just to make sure that you actually have A and B, which it means they are trying to probably put you in a plan, but they want to make sure you have Medicare before they spend time over the phone, I guess, you know?
Yeah.
So just be careful with that.
Yeah, I'm just gonna say if anyone calls you, they're not gonna call you. They're not, they're not- insurance companies, they're not gonna call you. You will have to call them if you have any questions. They're not gonna call you. So if anyone ever calls you and they're asking questions about, hey, or they personalize it, because they will not do that.
Yeah.
Do not answer anything. They
I,
will not call.
I would like to add, thank you so much for that comment. We are not allowed to call you without your permission, okay? If you didn't sign a permission to contact with an agent, or if you didn't submit your information online and they call you, that's not even legal. They are not allowed to call you if you didn't authorize it. So every time they call you to offer benefits, you can say, what you're doing is not even legal. You cannot call me if I didn't sign a scope of appointment or a permission to contact.
Yes, sir.
You might personalizing it. Are you referring to the fact that when they call, they start out by addressing you by your first name?
Yes. Yes. First name, last name. Could you verify your phone number? Well, you just called it. So no, they're not going to do that. Do not answer anything. Just let them know, hey, I'll just call you back. You have their information. You can just tell them I'll call you back and not by the number that they're giving you. So, and hang up. Any other questions? So we all good now?
All right, so thank you. I want to thank my brokers. Brenda will be here. She will be in the back. If anyone wants to do a one-on-one with her, she will be here. And of course, Miss Tanya is here. And one of our new brokers here, Miss Gloria is here. Thank you so much for being here, Miss Gloria. I thank God I am surrounded by a lot of good brokers for AEP and just throughout the whole year that can help educate us as community outreach specialists and help our patients and our clients in the community stay abreast on what's going on. So you guys, we have refreshments back here in the back. So don't leave, stay around. Talk to me if you're looking at switching over to your primary care doctor. And one of the insurances that I didn't mention earlier is Sage Health. We do accept TRICARE for life now. Yes, I did. I missed that one. Thank you, Ms. Gloria. We do accept TRICARE for life now. So if you're a veteran and you've been going to the VA for a while, but you don't necessarily like your doctor, and even if you love your doctor, you can see us as a primary, and you can also see your PCP at the VA as well. So you can have two. And I believe that's it. If you would like a tour to Sage Health, just let me know. We can set that up. And like I said, my brokers will be here for the duration of the time here, and we do have refreshments in the back. And Pastor, thank you so much for allowing us to be here again.
Glad to be accommodating to all of you. Welcome. Feel free and feel at home.
Thank you. Thank you guys for coming out.